Video.
Hi everybody, this is Dr. Missy. Welcome to Dr. Missy's Medical School. I feel better, I sound better. I have a lovely gentleman behind me who I was able to reluctantly convince to wear a pink shirt and get drawn on so I could teach you the different zones of the lung that you'll be drumming on, where you do your chest percussions to clear out the phlegm, to clear out the COVID, and to get you better at home, okay? Here we go. Thank you, Phil.
All righty.
So, he's tough enough to wear pink, guys. So, in black...
Wait, before you start, I'd like to say that the camera adds 30 pounds to you.
Yes, it does. To me, too. So, in black, you see that I've drawn out the bones. Got all these ribs over here, 12 on each side. You got the collarbone here and here, and you got the sternum. Okay? In the blue, that's the outline of the lung. And I put some little hatched blue marks there. And these little green dots are all those air sacs that we want to get the phlegm out of those things so that they can be air sacs again, and you can get oxygen to your bloodstream, to your brain, to your heart, to your liver, to your kidneys, to everything, so you can stay healthy. Here we go. The air comes in from the mouth or the nose. You guys that are wearing your masks down here, you can still get COVID through your nose. Come on now, wear that mask up here. The air comes in, goes down the main bronchus, off to the left side, it's fairly horizontal, and the air comes into the lung, and it's trying to feed this entire lung with air. The main function of our lung is to clean debris out, but mostly to get oxygen, exchange oxygen for the carbon dioxide that is built up in our bloodstream, so we can get oxygen to all of our vital organs, okay? And just think, every organ's a vital organ, right, Phil?
Some more vital than others.
Here's the other lung, outlined in blue. A lot of little spots here, which are the air sacs, okay? So the main spots, so these are symmetric, pretty much, except for the bronchus, right? The lung fields are pretty symmetric. They both got a collarbone, they both got all these ribs, they both got that sternum going down the middle. I'll show you with a red marker the places that worked best for me, okay? Let's turn this off. So the places that worked best for me were above the collarbone.
This is during the cupping exercises.
Yep. During the chest percussion. These upper lung fields above the collarbone and just below the collarbone worked really well. Right here in the center of the sternum where these bronchioles meet, that worked really well. The other spot that worked really well is this lower lung field, all down in here, all the way around. And that goes all the way around, okay? That's going to end up going on the side and everything. This lower lung field is critical. Now, I'm not saying don't do this center part. Please do. But if you're super exhausted, I would for sure start these lower ones, these upper ones, the center ones. Once your breathing gets a little better, go in the middle, okay? You're going to do the entire right lung field. And again, everything I say for the right, do it for the left. Everything's symmetric here. So that's one lung zone, the front of the lungs. Now I'm going to show you the side of the lung. So there he is. Oh, that one's got a hole in the armpit. Go to the other side. Sorry. All right, he's in there. I don't know if you can see. I think you can see it all. But anyway, the lung comes up pretty high. You see that?
Way in the armpit.
Way up into the armpit. You're going to actually start cupping in the armpit. And since the armpit is sort of a hollow, cupping in here, it takes a little bit of practice with your technique, but you want it to sound like you're banging on bongo drums. You want it to echo in the room. So cup your hands and you work on that, okay? So here's, again, lung field in blue. The ribs are black. The alveoli, air sacs are green. The spots that worked best for me when I was really sick were right here in the armpit. And for sure down again on the lower rib cage. If the person drumming can't tell exactly where your lower rib cage is, sometimes I would put my hand there, and I would put my hand down on the lower rib cage, and then Phil would know to beat from there up. Now these spots too, but your most productive areas are going to be here and here. At least that was for me. Do the entire left lung field. And also, you saw I had drawn on the other side your right lung field. Now we're going to go to the back. On the back, I've drawn the same thing out, okay? The bones are in black, so you see all the ribs. The rib cage protects your vital organs of your chest. So Phil's still got a little cough. We're on day 50. Anyway, your spine comes straight down the middle. Assuming you don't have scoliosis or something. But anyway, your spine comes straight down the middle. I've gone ahead and drawn the bronchial tubes out here where the right one's going kind of vertical and the left one's going kind of horizontal, where the air comes in, goes down, and then goes out into these two lung fields. On the right-hand side, again, all these little green sacs. Let's assume that green is phlegm. I was reading and I was amazed that there are 300 million alveolar sacs in a pair of lungs. That's amazing. So you got a lot of work to do. I sure did. So you're going to be breathing in, and the compressions don't just stop here. The compressions go up on top, the cupping, okay? You hear how that goes? It's probably going to make him cough. And right here, breathe. Take a deep breath in. Now I'm just doing that with one hand just to show you that it should echo in the room, okay? So that was it. We just wanted to show you the different lung zones. And Phil, thank you so much for wearing one of my tight pink shirts.
Think of that little cat with the 13-year-old girl who's dressing up the cat and the look on the cat's face going, "Save me!" That's where I'm at.
Y'all get better. Don't you dare get real sick with this. And if you do, please do all these things. I promise you it'll help, okay? We love you guys.
Bye-bye.
Bye-bye.